Welcome to the Handoff, the podcast for nurse leaders from Trusted Health. I'm Dr. Danny Bowie. Today, I'm thrilled to welcome Dr. Kristen Shelley as our guest. Kristen is a seasoned healthcare leader and an expert in workforce management and technology implementation. She has a background in clinical nursing and a doctorate focused on the use of technology in practice. She offers a unique and valuable perspective on modern nursing. Today, we discuss her experiences with incentive programs, the role of international nurses in addressing staffing shortages, and her current work at Trinity Health, where she's driving the implementation of a cutting-edge staffing and scheduling technology platform. Here's my conversation with Kristen. Welcome, Kristen.
Thank you. I'm excited to be here.
Kristen, as I mentioned, you and I have had a long-standing history and even some work history together. But I would love for you to share a bit more about your journey because it is very unique and specialized. And so if you can tell the listeners a little bit about yourself, your career journey, and what led you down the path regarding workforce specialization and technology.
You know, when I first became a nurse leader, I think like many leaders, what I really enjoyed about being in a leadership role is being able to make an impact. So, I understood, like I had been a bedside nurse for many years. I understood what it was like to be a bedside nurse, how chaotic it could be. The patient care is very demanding. And you have limited resources to really do what the best that you want to do on a day-to-day basis. So over my tenure as a nurse, I don't think I've ever seen a time where we've had enough nurses where we said, stop hiring nurses, we're good. We've never quite gotten there. So, the challenges today are even greater, as we all know, coming out of the pandemic, and patients are sicker, more complex. And it's a challenge to really keep nurses at the bedside. There's physical demands, emotional demands it takes. It's very taxing. But it's, work that, if you become a nurse, you want to be a nurse, you want to take care of patients. So as a leader, I think I've aimed to really do what I can in my leadership capacity to make it better for nurses. And not just our bedside nurses, but other healthcare providers and leaders. So I was in a hospital leadership role for about 10 years, in the acute hospital environment. Always really passionate about staffing and scheduling and trying to come up with creative and innovative new ways to improve staffing. Whether it was creating new programs to incentivize our current nurses or programs to attract new nurses into the organization, retain our nurses, really motivate them to want to stay. So how do you improve their work environment? And, a big piece of that is creating the flexibility, in their work life. So I did have, I really enjoyed being able to impact that piece of it. In my prior place of employment, a new division was being created from a system level, and I hadn't seen it yet in the organization being so specialized, and it was nursing workforce. So I got super excited that this role or in this team was being created. So I joined a role as the system director of nursing workforce, and that's kind of how I got into a very specialized pathway of looking at program development and implementing technology to support staffing and scheduling and the nurse leaders and providing the things that our frontline nurses really wanted, from scheduling, for example. So that's kind of how I got into the role I'm in today. So, and I've transitioned into a new role that's very much more tech focused, and it's been exciting as well. And I can talk about that more in a little bit. But ultimately, looking at leadership from a different perspective, from that technology perspective, has been very interesting. Something I never thought I would get into before I did. And now it's kind of that pathway and that journey that I'm really excited about, kind of transforming what it looks like for the flexibility and the transparency of resources and all those things that come with technology. And how to impact not just nurses, but like I said, healthcare staff in general, and ultimately impacting improvements in patient care.
I am really impressed with your journey and your ability to pivot and move into these new spaces as a leader in workforce, a problem solver, and kind of taking on an entrepreneurial role for, Bon Sequoia Mercy Health, and then in your new role at Trinity Health. And as you know, this season is around workforce, and I'm asking leaders across the country, what does flexibility mean to these leaders in unique spaces in health systems, as well as, to the nurses they're leading. So from your perspective, Kristen, as a nurse leader who's had years of experience in this space, what does flexibility for the workforce mean to you? But also, what does it mean to the nurses that you lead?
Yeah. And as you said, workforce flexibility, that is a term that's kind of thrown around. So I'm glad that you asked, what does it mean to me, in my leadership style and in the work I do, what do I think of when we say work flexibility? So it means a couple of things to me. I think we know today's nurses or really any kind of healthcare staff are desiring flexibility in their work schedules that can accommodate that healthy work-life balance. We've always talked about how do you achieve the healthy work-life balance? And, and now it's really time to pay attention to that. We're having a difficult time keeping nurses at the bedside. We as leaders need to be flexible, right? And meeting the needs and the demands of our nurses and other healthcare workers. So scheduling flexibility, I feel, is a top priority when you're implementing new scheduling technology. So the technology needs to be able to accommodate that, support the goal. So for example, being able to self-schedule or select a preferred schedule is foundational for scheduling autonomy and flexibility. So the tech really needs to support that. I feel like that's a foundational piece in scheduling technology. Other things like trading shifts, picking up shifts, requesting time off, all those things need to be built in the technology and having it available at, the end user's fingertips, at, our nurses' fingertips, having a mobile option, so we know that everyone does everything on their phones. So we need to make sure that they have that level of ease and accessibility to do their staffing and scheduling functions. We know that schedule and what you're working is a very important, piece of, being happy in your job. So the other side, I think, of work flexibility comes from really breaking out of the traditional schedules that we've known for so long. For example, 12-hour shifts. That's been a standard in the inpatient hospital environment for years and years. And that type of shift may work and may be desirable for many healthcare providers, nurses, and other pieces of our workforce. But there's also a growing population of nurses that want other options. So how do we think outside the box, look at other programs? Can we offer shorter shifts or variable shifts? Can we look at programs like weekend programs or summers off programs? Those are a couple of things that I've seen, recently that have kind of tried to meet that need of the flexible workforce. We're also looking and seeing more of telehealth or virtual care models. So those programs are definitely think outside the box programs, and they really offer nurses that are maybe transitioning away from the bedside, but really want to remain in patient care. They get that option to still provide that care, but in a physically less demanding capacity. I think it provides that flexibility to really keep our tenured nurses, our more seasoned nurses involved with our patient care teams by providing that level of flexibility. So obviously work flexibility is so important and we really can't ignore it.
It's music to my ears, Kristen, when you talk about building technology and then ensuring the foundations are in place. Self-scheduling, we know that that's a big ask of the workforce, trades, and also just pushing the limit to ensure that your tech build supports these foundations, and then you can move into broader innovation. I'm curious if you could talk a bit more around, technology is key. How do you gain perspective from the front line as well as use from nurse leaders in this space? Because it's there, but oftentimes it can be a challenge in getting tech in place. And so is there anything that you could share with the listeners about, from your experience, some tactics or things to think about as they look at technology or they want to bring it into practice and make it meaningful for the users, but also adopted by the leaders and the frontline clinicians?
Yeah. So as far as, understanding what it is that, our nursing workforce or healthcare workforce really wants to see from the technology, some of it ends up being kind of user groups as far as, finding out, just talking to nurses and those that use the technology, what would be an improvement that would add value. We don't want to just roll out technology that doesn't add value. It's just going to sit there and not be used. So what's meaningful to them? Is it, I really want to see my schedule at a glance, and I can't do that today. Is it, like you mentioned, some of those functions that they do on a regular basis, like picking up shifts, like, can I get a text message from the system and say, yes, I want to work this shift, and boom, I'm on schedule. Those type of ease of use of technology, I think, are important things to evaluate and try to design or configure into any new staffing and scheduling technology that you're going to invest in and implement in your organization. And as you mentioned, the adoption piece, that's so important as well. Like I said, but if you're designing something with the end user in mind and with the input that they provided, this is what I want. If you're providing those functionalities, you would expect some adoption with improvement because it's meaningful technology. But, I think you need to have support from the top down, right? So what is the expectation for the use of the technology? Why are we using this technology? How's it going to help me as a leader? How's it going to help me as a frontline nurse? And making sure everyone understands the why behind the change and how it should ultimately, right, make your life a little bit easier in the workplace. So getting that buy-in and understanding, but also that expectation from your executive level sponsors so that we're all using the technology platform in a consistent manner so that we can pull data from it, we can do analytics and look at future staffing needs or trends and adjust accordingly.
I like it. Ease of use and then build for the user creates the adoption. And, I hear kind of this multifaceted approach that you're taking, which is hear from the front line, hear from your stakeholders, which is going to be your nurse managers, and then also the engagement of your executive leaders as well. It's a holistic process. Staffing and scheduling is the biggest move that people take when they implement tech, and it can be the most painful thing. And so I think those are really great call outs, as I know a lot of health systems go through this transition, is thinking about setting up those programs to get that feedback from the front line, to build with their perspective in mind, and then to also ensure that you have different support at different levels for that success and sustainability around that. Just great call outs, Kristen. And yeah, that's part of my passion is workforce technology, and even the reason I joined Trusted Health, because I just saw such great innovation around our tech, but also it was designed with the clinician in mind and the nurse manager in mind to ease their operational burden. So just really passionate around that. A little bit more about your role at Bon Secours Mercy Health. And I know that you've done some really innovative things there, as you mentioned, starting in a space that didn't exist before, building at the system level. And there's some unique programs that you helped design specifically, international nursing and an incentive program that was proactive. And I would love if you could share a little bit more around some of the programs you designed and anything that would be helpful for the listeners, because I know international nursing is a hot topic and everyone's looking at it. Incentivization and open shift management is another space that has been a pain point through the last 3 years of the pandemic, and just would love to hear some of your input around the innovative programs you designed there.
Yeah, sure. So my role at Bon Secours Mercy Health was that system director of nursing workforce. So as you mentioned, it was a new type of role. So it evolved in the time that I was in the role. So you mentioned international nursing, so I can start there. So obviously with the nursing shortage and the challenges that everyone has been faced with, we're really looking for new pipeline, new nursing pipeline. And, one of the things that I implemented at Bon Secours Mercy Health was the international nursing program. So that work really started pre-pandemic. So it wasn't an afterthought, like, oh, we're in the pandemic, now we need this international nursing program. It was work that was already underway prior to pandemic. But by the time, we were coming out of the pandemic, we were fully implemented into the program and seeing, probably about 30 nurses arrive every month to start to the organization. So it was a great new pipeline program. The nurses were coming in with great experience. Sometimes you worry about, these are, nurses coming from other countries, what you don't know what to expect. But, we were getting very high quality experienced nurses. And part of that was the design of the program and making sure they were being oriented correctly and transitioned. We wanted to make sure they felt included in their teams, and not just their teams in the departments, but also in the communities that they're living in. So that's really key and important piece of having a successful international program. So there was a lot of collaboration, multidisciplinary with multiple teams and all the various hospital sites and their nursing leaders to make sure that we had things in place to really support the nurses. So it was a great program. We developed a toolkit, so that not only the incoming nurses felt supported, but also the teams that were already in place as far as what to expect. And, we saw some great early successes, especially the critical thinking skills. These nurses are coming in with 10 plus years of experience. So they're really bolstered that support for our newer nurses where, we've seen, a lot of nursing units have low levels of experience just by nature. So bringing in the international nurse really helps support that growth and support for the new nurses.
You mentioned a toolkit, which I think is fantastic. You also talk about cultural assimilation, which is a key piece of not only learning your skill as a nurse, but then assimilating into the new country that you've come into, a new team that you're working with. As you think about that toolkit, and I'm sure leaders listening are like, man, I wish I had that toolkit. That you could say, like, these are some of the pieces of the toolkit that we included, and it went to the frontline leaders in support, so that they, as other health systems are designing and building these programs, they could think about some different subject lines of that toolkit or program development that they should be mindful of.
Yeah, so some of the pieces of the toolkit, some of it was more overview for the leaders, the nursing leaders that were taking these international nurses onto the unit. So more about the vendors and the contracts and those sorts of things. But then, we get into, it's important to have preceptors and mentors for these nurses that have a key set of characteristics and attributes that really support that type of learning for these specific to the international candidate. So it's how to some of the toolkit was how to identify those individuals and then how to develop those type of support models for the incoming nurses. Some of it was that cultural assimilation training for our current staff. Some of it was orientation specific to the international candidate as far as what to be mindful of. We work with other, multidisciplinary teams to really identify where these nurses are coming from, which countries, and what we should be mindful of in their learning plans. So really creating individual orientation and assimilation plans for each nurse, I think is really important. And those are outlined in that toolkit, really trying to create a successful environment for our nurses.
That's great. Thank you for sharing more around that. I was curious, and if I'm curious, I'm sure others are too. So that was really helpful. And then also, I know that you created a really innovative incentive program at Boxcar Mercy Health, which, as I mentioned, was another pain point for a lot of health systems. And what I know to be true about that, it was unique in that it was proactive. So if you could talk a little bit more around how that program was built, the intention of proactive recruitment, and some of the, even the pain points in implementation, and how you think the incentive program should continue to evolve as we think about the workforce.
Sure. Yeah. So the main focus of the revised incentive program was, as you mentioned, early incentivization. So one of the biggest challenges I think many of us see across the organizations is that if we're going to incentivize nurses with a higher dollar amount to work an extra shift, sometimes nurses and others may hold out, right, into the last minute hoping that the dollar amount will be raised because we're desperate for help, right? So this program was trying to get ahead of that curve. So how can we offer, that higher level amount early? And then as you get closer to the start of the shift, you decrease that amount. So you're really trying to steer, nurses into picking up those extra shifts early on. And that way you can better plan, you know what's covered and what's not. And then nurses aren't necessarily holding out for that last minute bump in pay. One of the biggest challenges that we experienced during this implementation was we were in the middle of a pandemic. So it became very challenging to hold to the standard of the new program simply because, we had, just like everyone else, nurses were out on leave. They were exposed to COVID, or they had family members exposed as well. So our workforce was dramatically impacted. So it was difficult to stick to some of the standards. But as we came out of the pandemic, it was kind of a refocus. Like, okay, this is the aim and the goal of this new incentive program. And let's get back to it. I think we did see some benefits coming out of that and some cost savings just because you have better control over your spending. Ahead of time, when you post your schedule with open shifts, you can tag those shifts with that highest level incentive to start with. So, this is the maximum of what I'm committing to spend. And as we get closer to the schedule, hopefully we have fewer open shifts remaining, and the dollar amount for those remaining shifts is going to be lower, but much easier to budget as far as what you anticipate spending if you need to in this incentive spend, and then keeping a consistent program. That was the other piece. We saw that our incentive programs were so variable and so different across the organization, and sometimes in the same region, hospital to hospital. We saw inconsistencies, and nurses talk, right? So they know hospital over down the road is offering more money, so it's not fair here. So we created some equity and fairness by consolidating at least across the market levels as far as what incentive amounts could be offered, just so we had a consistent practice across the different regions in the organization.
Yeah, you move from a variety of different policies and practices in place to a standard approach with a mindset of early incentivization and then market variability per pricing. So it sounds like you did a fantastic job leading that and trying to break out of what you mentioned, which is the pain of all incentive programs, is holdouts, or I call it gamification, where the clinician, and they're smart. Nurses are smart. They're understanding, hey, I'm going to hold until it's last minute and then get the highest dollar amount. So I really like hearing that. And kudos to you and your team for being able to take that on during such a challenging time and create that standardization for a lot of nurses over 7 states. I want to transition quickly and talk just a bit more about your work at Trinity Health. And we talked about this in the beginning of kind of you've transitioned into these unique workforce roles. But can you help explain to the listeners specifically what you're doing at Trinity Health and how your role is focused over the next couple of years around technology and flexibility for the workforce?
Sure. Yes. So I've been at Trinity just for a few months now, just transitioned. But I will say the vision and the mission of the organization is in direct alignment with the work I've done for many years now, and has felt like home in a way. So it's a great organization. It's a large organization. I've seen many innovative and creative strategies in place. And like I said, I haven't even been there that long. But my current role is a senior consultant of workforce management, and I am charged with a system-wide implementation of staffing and scheduling, a staffing and scheduling tech platform that's aimed to bring flexibility to the clinicians. But I am responsible for ensuring that successful implementation and adoption and optimization of the scheduling component in particular. So it's right up my alley, it's where my passion is. And I've been super impressed that, with this technology that's being implemented, I'm not seeing shortcuts, so it's that full scale package, and it's really exciting that the organization has invested in this technology for, all the colleagues there, all the bells and whistles that will really make a difference. So it's not just, like I said, it's not before, it's not technology just to say we implemented new technology. It's really intended to create efficiencies and the flexibility, like we've mentioned, for the workforce. And it should have a positive impact from the frontline staff all the way up through top level leaders. As I mentioned, having that standardized tech platform, which eventually over the next couple of years will get fully implemented, you have a transparency and a consistency on how you're receiving data around staffing and scheduling, and you're able to conduct those analytics instead of trying to piece them together from several different systems. So it's really exciting to be a part of that. Our first wave is set to go live this summer, and I'm excited to be a part of that and to be, side by side with these leaders to really help make sure everyone understands the technology and support them through how do we make it, set it up for individuals' preferences so that it works the best for them. That's what my current role is, and I'm sure it will evolve over time, but I'm really excited to be part of that technology implementation in helping nurse leaders and other leaders and frontline staff really understand how and why this technology is being put in place to help support what they do every day, day in and day out.
You sound like the perfect person to be doing this work. And the reason I'm saying that is you have experience doing it in the past at Mount Sequoia Mercy Health, but you're also a clinician. And you're a doctorally prepared clinician. So you have led and seen all the different ways that clinicians interact with the system. You've built before and you're doing it again. And in fact, I believe, I know this to be true, you also doctorally, your thesis was around technology and use of that technology in practice. And so, it's wonderful to see how your career has grown into kind of this niche. But I think you're a perfect person for it with a clinical view, but also the technological understanding of staffing and scheduling policies, workflows, and roles that need to go into that. Can you also, as I just called out your doctoral journey and thesis, give a little insight into that about how you studied and what your thesis was about, and then before we move into some final questions.
Sure. Yeah. So my doctoral project was focused, like you said, on technology, but a little bit different than the staffing and scheduling component. The hospital I was working for at the time was using technology that, that staff were locator badges. And so you could track their time through the system of how much time they're spending in patient rooms, how much time they're spending, in the medication room, how much time were they in the break room, how much, and it wasn't intended to be a big brother type of technology. It was really to help us improve our workflows. So I did a study looking at patient satisfaction. As we know, that's a very important piece of leadership in the hospital setting in particular, and other settings as well. But, you're reimbursed based off of your patient satisfaction. So it's an important metric to pay attention to, besides the fact that you, of course, want to make sure your patients are satisfied with their care. The study that I conducted for my doctoral project was focused on, hey, if we increase time at the bedside, will we increase our patient satisfaction scores, whether it's, communication with nurses or whatever piece of that patient satisfaction it might impact. It was kind of a explorational study to see what happens. The study involved asking the nurses to do all their documentation at the bedside. So although that's not necessarily direct patient care at the moment, you are physically in the room with the patient and accessible to that patient and their family to ask questions or whatever it may be. So we did about a month period to see if that increased time at the bedside improved patient satisfaction scores. And in I did 3 units, I believe it's 2 out of 3 units, we did see an improvement in the scores. And that's a published article as well.
Great. Well, we'll have listeners Nursing Management is the journal. Dr. Kristen Shelley is the author. It's about leveraging technology and the way that the experience of the patient can improve with the clinicians engaging in technology. Kristen, this has been really insightful. I appreciate, again, your unique perspective around workforce, flexibility, technology, and the way that you've embraced this as a clinician and a leader, which is really impactful. And I think just the model that we as a profession need to replicate, leaders embracing technology. I would like to just end the podcast with asking you the question we ask all of our guests is, what would you like to hand off to our listeners today?
Well, I think, based on what we've discussed today, surrounding technology in healthcare staffing and scheduling, I think it's just important to stay in the know, right? We know technology and staffing practices are constantly changing. They're outdated very quickly. So we need to stay networked, with your colleagues across different organizations, do the research, what's new and innovative that's being done and you haven't done it yet. So, and also, as we spoke to earlier, I think we need to listen to our workforce and find out what it will take to make their work lives better. So constantly adapting and changing to the needs of our workforce. I think that's the key takeaway. And we know that technology can really help support that.
As we look for flexible solutions, you hit the nail on the head. We, as leaders in health systems, need to be flexible and adapt to the changes that are at play and the research that is new. Dr. Kristen Shelley, thank you so much for your time, your insight, and your expertise. And I can't wait to hear all the success stories around the health systems that you help with technology and the workforce. So thank you so much.
Thanks, Dr. Bowie.